Truth, lies, shenanigans.
B, you're up first. Tell us about these legal crack houses in Canada.
Oh, Lord.
All right.
He cringes every time I say it.
He does.
There's a little part of me that dies on the inside every time I hear that. But basically, what my story is, after several years of planning, a safe injection site has been opened in my city, the city of Greater Sudbury. So the new site's going to be run downtown by Eisenhower Organization, their local harm reduction group, and it's going to be located near the Sudbury Courthouse, which is close to our downtown core. So those unfamiliar with the term of safe injection site, it goes under many other names, including supervised consumption services, overdose prevention centers, fixed rooms, medically supervised injection centers, and drug consumption rooms. Some of the services that are included at these sites is access to clean drug use equipment like needles, drug checking to see if the drugs contain more harmful substances like fentanyl, which we've discussed on the show previously. Emergency medical care is available on site. Basic health services, so if anyone comes in with a pre-existing wound, they can receive treatment. Testing for infectious diseases like HIV, hepatitis C, STIs. So, I mean, there are a number of services that really get put in touch, that people get put in touch with. Access to referrals, social services, housing, employment services, rehabilitation services, and access to drugs and healthcare for recovery. So, Neo, if you wouldn't mind just pulling up that other graphic for me real quick.
Absolutely.
Thank you, my friend. There we go. So this is just a graphic from Infogram where they just listed some pros and cons, and I just wanted to list them off real quick. So under the pros, they give addicts a safe place to inject drugs, increase access to health and social services, help prevent overdoses. They help reduce the stigma of addiction, decrease the spread of disease, and it can save the city's time and money. Cons might encourage drug use, challenges federal drug laws. Studies on safe injection sites might not be reliable, and they may bring crime into the surrounding communities. So, with that preamble,
I can imagine a lot of crime.
yeah. So please share your thoughts on safe injection sites. And follow-up question, how would you feel if your city opened one up in your neighborhood?
Why don't we start with Dr. J on this?
Yeah, this is a hot topic. I mean, because there's several cities here in the United States that have done not quite the whole injection um, place, but have gone out into the community with needles and testing kits and things like that. And I mean, on one hand, I mean the epidemic is so high, folks are just dying. There's cities that have how long it's been since an overdose has happened, and most of the time it's 0 days. Um, I can also see the other part of it. I can say as a mom with teenagers, you know, the concern of the crime that may be coming along with it, and also the people and their intentions. I think, as a mom, you worry about who your child could possibly be exposed to unintentionally.
It's
Um,
true.
I think that it's it's a necessary thing. Like we have to do something, and if this is one way of attempting to get people clean, um, but also keep them safe
Yep.
because communicable
Yeah.
diseases are very high among drug users, and those do spread out into the regular community because it's not just drug users that they're encountering or having sex with or things like that. So you're looking at herd health, if in my world,
Yeah.
herd health and keeping the community safe in that sense. But it is definitely a hot button topic, and it's like, on one hand, you're like, well, yeah, if you can have it in a place, but then, these addicts are in your neighborhood. I mean, you may not be happy about it being next door, but these addicts are already next door. But I wish, hopefully maybe like keeping in a certain distance away from school or certain
Yeah.
distance away from other places. Like I would say, like in my world, we have drugs that we have to use on these animals, and so we don't want somebody coming into our business causing crime in our business trying to get a high. So It's kind of hard. It's like I see both sides of it. I mean, I think overall it's good, but there's a lot of other.
Yeah. Yeah. What do you think? What do you think, Johnny?
I have mixed feelings. I do think that if done correctly, like Dr. J said, I think that it could be a success in getting people treated and recovering. The reason I have mixed feelings though is because I haven't lived the life of obviously I'm not a drug abuser. So is it for the people that are in that situation, I wonder if it really does like is a stepping stone to their recovery.
Recovery.
And I would like to like actually take the time and to research if that has helped people. I know that there was during this article a person that has come forward and mentioned that it's changed her life. This type of
Do you know, Rob, the
facility.
statistics? You know, Rob?
No, because this is still pretty new, so I couldn't speak to the overall success as empirically. So no, I don't really have any numbers that I can share with you at this time.
Yeah. Go ahead, Johnny.
No, at first I did think it was counterproductive because it was like you're hosting the very thing and encouraging the very thing that people are trying to avoid. But when I did further research, I like that Rob said to, you know, to try to break the stigma of it, you have to do more research into it. But there are some cons that I feel like they didn't mention. Um, the con could be also what if well, not all, but what if the majority of drug users don't go there? You know what I mean? What if they, even if it is meant for them, what if they feel like, what if it just doesn't work to reach enough people? You know what I mean? So I feel like the people that are really like wanting to help themselves would go there. But
Mhm.
for the most part, I don't see how, I don't know. I think it's a good step, but I just don't see how it could transform people.
Yeah, I know I keep referring to them as like crack houses and drug dens, and I know it bothers Rob, but to be honest, Rob, when you first told me about this, it's the first thing I thought of. I mean, it's what
And
I pictured in
and
my
it's
head.
the opposite of. It is
Right.
the exact opposite
Literally.
of.
It's intended to be the opposite of. I get that. I get that. Right. But it does remind me of like those old opium houses in back in the day where they used to sit around and just do opium all day. That's the picture that came into my mind, or and this is a picture of like the drug dens that happen. Those were the pictures I had in my mind. But then when you realize these are the drug dens and they look so awful. I mean, dirty, nasty, drugs all over. I mean, it's just unhealthy.
Dangerous.
And then when you look at what it actually looks like to be in one of these sites, it's a totally different atmosphere. I mean, you do get a sense of safety and a sense of, um, that there's a potential to help these individuals at some point, or at least change, the thoughts or change how they see it. So I'm not going to say I'm against the idea. I mean, given the current alternative with all the crack houses and dens out there, I mean, and it does, yes, it could create a bad element where kids and stuff are, you know, in danger. And that's the stigma that we have behind it. But this place would be something different, you know. And
Mhm.
yeah, it could still lead to some sense of crime, but these are all supervised um, facilities. So, but
Yeah.
I mean,
go
there are
ahead.
a lot of documentaries like on Netflix about drug use, and that these folks are going out and doing this type of work. Providing the clean needles and providing the testing kits and stuff. And it looks like, I mean, at least the documentaries, and they are all have their skewed viewpoints, but it does look like it does help. I think it's the question definitely is going to be like, who's going to go to it? I guess it's like homeless shelters, like there's homeless
Hmm.
shelters, not
Yeah,
everybody
Mhm.
goes to one. And I think it
that's
just
what I'm
has to be
saying.
kind of combined, like you have this site, but I think you also need the outreach. You need the people who are going into the dark,
Yeah.
cramped, ugly looking places finding these people because there is still a lot of stigma about it. There's the addiction is real. I mean, it's an illness. I mean, yes, on one hand, like no one starts you from doing drugs, but those that are addicted, it's just really sad because it just destroys so many, the family. It just
But you know
destroys
what,
a family.
Robin? there are, and that's one of the stigmas too, where people, no one's born into that situation. No, some people are absolutely born into these situations. It's
Yeah.
they pattern from what's around them. This is their life. This is their reality. And the system has failed them because these parents kept custody of these kids and messed them absolutely up. And the main gateway to drugs is trauma. It's not marijuana, it's not alcohol, it's trauma. And
Trauma.
Yeah.
that's it. You need to, I like the idea of the safe injection site just as a point of contact. This becomes a safe place. And if this is the first safe place that these people have encountered in years, then you can start having a dialogue. And if the trust is there, if the dialogue is there is a long-term plan, but it's not like they're snatching people off the street and saying, "Hey, we're going to get you clean. You got to shoot up here first." No,
Hmm.
it's to make sure that these people
Yeah.
are safe, that they are being taken care of. And I know that a lot of the medical resources, the medical team resources, are squandered with just responding to overdose calls. So if you have people in a safe injection site and you have paramedics on site and you have the naloxone kits on site and you have trained personnel on site and you're testing the drugs for purity before they inject it. So, hey, we found this much fentanyl in it. Probably should use maybe just a smidge of what you normally would use. So
Yeah.
it's
I mean,
I think that there's definitely a lot of benefits to it, and I appreciate what people are saying. I think it was Jacqueline who put that up online, saying, NIMBY, not in my backyard, and
mhm.
I totally get it. This is something that's important. It's something that needs to happen. And again, if the proposed site was up my street, I would probably have mixed feelings about it because this brings in an outside element that may not necessarily have been there before. But the sites
Right.
are selected based on proximity of where the drug use is actually already occurring. So there's
Okay.
already a population there that they want to serve, that they want to connect with. And the fact that they chose something that's close to the Sudbury courthouse, there's definitely some commercial traffic, less residential, but there's definitely some residential in the area. But
I,
like
ju-
in most cities, if you want to find the crime in a city, go downtown, right?
Yeah.
I mean, I just want to say, I think my big concern is that if it came to the US, is that we find a way to monetize it. And then instead of helping people get off the drugs, big business will start finding ways to get more people doing drugs so that they can profit. Like with anything else, if there's money involved, people, especially in the US, will find some way to pervert it. That's my biggest concern about it here. And, I like it.
Do that. There are already cities that do that.
Yeah, and they're
Mhm.
right. They're already doing it. Right. But
Yeah.
New York.
I just feel
Yeah.
like in time, it's just gonna it doesn't matter. It's gonna be perverted here.
Mm.
If in the right hands, if done right, like I said, or in the
When
right
is it?
hands, I don't
When
think
has anything in this country been in the right hands?
you got to leave the feds out of it.
Oh, shoot, some of these states, shoot, you gotta leave some of these states out of it too. I'm telling.